Hello, welcome to Aspen Ideas Health. It is great to be back in person. There's nothing like it. And let's hope that this is the beginning of a many-year run where we get to keep doing things this way. I'm Alan Weil, Editor-in-Chief of Health Affairs. We're the nation's leading health policy journal. It's my great pleasure to be able to lead the conversation today. So imagine waking up one morning, going to work, meeting your 80,000 new employees, overseeing a quarter of the federal budget, having responsibility for programs that literally touch every single American, not just the big coverage programs like Medicare and Medicaid, but the National Institutes of Health, the Centers for Disease Control and Prevention, the Food and Drug Administration. It's pretty hard to imagine. But we don't have to imagine it, because today we're going to hear from two people who lived it. And the focus today is not going to be on the details of policy and whether we should change one program into another. We're going to talk about what it's like to be secretary. And we have two perfect speakers for the job, Donna Shalala and Alex Azar, both of whom are going to provide their perspectives on this experience. And so I'm going to walk them through a series of questions, and then as we have time toward the end, you might think of the questions that you have for them. But I do want to start. It's really hard for me to imagine day one. So give us the feel. You literally walk into this office. What's on your desk? What's on your agenda? What is expected of you on day one? Donna, you want to tell us?
Well, what was on my desk was this big briefing book that the transition team had done, and so I put it in the wastepaper basket because I had sort of read it, and it sort of recommended new layers of bureaucracy, new undersecretaries, and I thought, you know, this is written by people that have never run anything, so I threw it in the wastepaper basket. But I remember walking into the department, and there were a couple of secretaries there, and there were typewriters. I hadn't seen a typewriter in like 10 years. I had come from Wisconsin. We had computers. So that was shocking. But day one, I brought with me a couple of people, including my chief of staff, and a friend who did HR, because I had already been working on who I wanted to recommend. And day one, that's exactly what I did. I did the list of who I wanted to recommend to the president, and because I had been in government before, I was very anxious to get to the president and the vice president for a sign-off before there was a White House personnel office. I had been in government before, I knew how they could hold things up, so I was just going to run over to the White House as soon as I had sort of the list organized. So that was what day one was. Was it shocking? Not as shocking as when I was an assistant secretary at HUD and there was no furniture in the offices when I walked in. I mean, there was literally furniture. And there was a letter from my predecessor, a very nice letter, saying pay attention to certain issues.
Alex?
So I had been deputy secretary in the Bush administration at HHS, and the way the office is configured there on the 6th floor, the secretary and deputy secretary have this private elevator from where your car will take you into the garage. You come up, and secretary's suite is on the left, and the deputy secretary is on the right. I come up that very first day, and I start walking to the right, just instinctively. And then
that wasn't because you were a Republican.
Right, exactly. Yeah, 3 right turns instead of 1 left, right? And so my security detail says, no, sir, over here. And so we go in, and I sit down in my office, and my new office, and it felt very strange being there. I really felt like Secretary Leavitt was going to come in and say, get the hell out of my office, really for almost 6 months. It really, for me, because I had been around HHS for a large part of my career. I view myself as almost a career person at HHS. In fact, when I left at the end of the term, HR sat down with me to talk to me about my retirement. I'm like, wait, I get to be a retiree? I've been there so long. In terms of the issues, what struck me was how they're still the same. So I left in 2007. I got back in 2018, so almost to the day, an 11-year gap. and it was the same daggone issues. It was the same payment regs from CMS. It was the same, some of the same pending regs at FDA that still hadn't gotten out. I was able to jump right in, no learning curve on so much. But Donna talked about personnel. My predecessor already had 7 months, so things were pretty well set on personnel. For me, laying out an agenda quickly, there's nothing like speed when you start a new job. It's sort of the height of your power and influence, that beginning. I had 4 key issues I wanted to really focus on and drive transformational change on, and so for me, I tried to move very quickly to lay out in public ways how to deal with the opioid crisis, how to transform how we pay for health care. I wanted to get fixes out on Obamacare, did not succeed in getting that one out. And then our drug pricing agenda, try to lock that in before all the White House staff and other constituencies, all those external people who are vested in the status quo will work to basically engineer how to keep the status quo when you're trying to break that.
Yeah, it's interesting, Alan, that he set the agenda, because I was there on day one, the day after the president was inaugurated, and I was sworn in that day too, because we had our hearings before the inauguration, and so when we walked in, we were actually legal. But the president had an agenda. He had a very clear agenda, and one of the things that happens in a campaign is that some college dropout follows the candidates around, and they make promises. So they write down the promises, and then there's a book put together that's basically called Promises, Promises, and then it's handed out kind of to the cabinet officers, and you look at it and you say, he didn't say that, did he? But the president had one thing on his mind when I took the list of people I wanted him to sign off on, and that was immunizations. We knew how we were going to do health care reform with Hillary, but it was immunizations. He wanted every kid in the country immunized at the right time. They were getting immunized by the time they went to school, but they needed to get that before they were 3. And he said to me, you know, it's a great second-term campaign issue, so get all the kids immunized. And that's a separate story.
Right. So the Promises book you can't throw in the trash.
No, you can't throw that in the trash.
You've both alluded to what you were doing beforehand, and you each came to these jobs from really very different experiences, but you've already referenced how those experiences helped you when you got into the office. I'd like to hear a little more, if you would, about, I mean, you ran a large research university. That's pretty different from where I sit. It sounds pretty different, but you clearly took a lot of lessons from that. And Alex, you already mentioned your prior tenure. What is it from your previous experience that was the most valuable as you walked in the door as a new secretary?
Alex, do you want to?
If you like, I'll start. I'd say from having been at HHS before, knew the programs, knew how this bureaucracy works, and frankly, having been both at HHS and at Eli Lilly, very large bureaucracies, they really function very similarly. So it's how do you lead an organization that's matrixed with diffuse authority? You don't have dictatorial power. You have to bring people along. You have to work through consensus. You have to get people to actually think everything is their idea, to want to buy in, have a sense of mission and vision around what you're trying to achieve, whether it's in a big company or a gigantic government bureaucracy. And so there was that just skill of management and leadership. Then most relevant for the pandemic was the fact that with Secretary Leavitt, I worked with him intimately on creating the first pandemic plan, and something that doesn't get talked about a lot, which was the pandemic flu vaccine enterprise. We did sort of a version of a Manhattan Project on that as part of the pandemic flu plan, where we funded and created expanded egg-based production, cell-based production in the United States, excess capacity, guaranteed markets for flu vaccine. That's what enabled the H1N1 vaccine to be available concurrently with seasonal flu vaccine in the Obama administration, was that effort. That, and then I go at Lilly, and I get to understand really the depth and how to lead businesses, the financials, the incentive structures of business, and how drug manufacturing really works, and why when it doesn't work. So when it's time for therapeutics and vaccines, able to combine those two strains of understanding to create Operation Warp Speed, understand how do you solve the economic problems that make it slow to get vaccines and therapeutics, using the full power of government and having, as I think the New York Times called me, the happy regulator, which is an odd thing for a fairly libertarian free market guy, but I have no problem using the power of government to fix problems.
I came from a different experience, obviously from one of the world's great research universities, the University of Wisconsin at Madison. But it was easy, first of all, I had been in government too as an assistant secretary at HUD in the Carter administration. But it was easy for me to conceptualize the department. I also had Social Security first term. So I was used to a decentralized institution with powerful deans. It's not much different than the head of FDA, NIH. In fact, it was easier than dealing with a medical school dean or a Rochelle Walensky, our great director of CDC, is here. I thought working with CDC was a piece of cake compared to the athletic director at the University of Miami. But I was used to powerful deans. And the directors of those great agencies had huge egos and were very talented. And so I found it easy to manage the department, but I had to use systems to do it. The budget process, the policy-making process, making sure everybody was involved. In fact, the first couple of years, I made everyone, all the agency heads, sit through the budget process of each other so they could understand the department and then make the department's budget. It was an exercise that bonded them, and in the first couple of years they were giving themselves money. In the second couple of years they were giving each other money. So, and finding where the overlaps were, but more importantly, it just bonded them. I mean, it was an exercise. And in the policy-making process, I invited everybody. Whether they were directly relevant, I had this huge conference table, and everybody came for all of the final policy decisions, including the civil servants. So I used my academic experience in a decentralized organization. I was used to powerful personalities, and then I used some exercises to pull people together as a team. But remember, I had something different that no other secretary recently has had. I got to appoint the team.
Yeah.
The president and the vice president signed off. I had everybody confirmed by March 1st.
But,
and they stayed for 8 years.
Right. But to Donna's point, the management challenges of something like HHS or any of these big bureaucracies are incredible, and there's very little thought given in selecting leaders of these organizations. Too often it's a focus on subject matter expertise. You know, HHS is 3 times the size of the Defense Department in terms of budget. It would be the 6th largest nation on earth. It's the US, China, Japan, Germany, France, HHS, and then the United Kingdom. And leading those kinds of organizations, that's not beanbag. And it takes a lot of experience and a lot of knowledge on how to do that to get those organizations to work effectively. I think it's not accidental that the most common other jobs of HHS secretaries are university presidents and secretaries of defense. Very similar
governors.
Organizations and governors.
So when I was a member of the governor's cabinet here in Colorado, just take 3 zeros off of everything you all handled in terms of budget and personnel. But structurally, my experience was I had the internal management issues, I had stakeholders, I had the governor's office, the White House, and I had the state legislature, Congress. I'm curious if I found a lot of my energy went into figuring out how to allocate my time and energy to those 4. Which fire do I put out? Who do I need as allies? I wonder if that's how you experienced it, and if so, how you made decisions about where to emphasize your energy, internal, stakeholder, White House, Congress.
You know, it depended on the month. Here's my theory of managing these complex institutions, whether universities or government agencies. At this moment, someone in my organization is doing something stupid, and I'm going to have to deal with it when I get back to the office. And so I'm the coolest person around. And, you know, it just depended on the month, whether the Congress was in session or anything else. But in terms of balance, who I saw, what issues I worked on, we used a lot of analytics for that to make sure that there was a balance. I didn't want to see one interest group and not see the counter one. So there was some of that. I was at the mercy of the congressional committees, and HHS has a lot of committees that the department is spread over a number of different committees. So when the Democrats were in power, they were somewhat more demanding than when the Republicans got into power, because I had both Republican majorities and Democratic majorities. But in terms of, I'm just very focused. So, and my deputy secretary and chief of staff would limit what actually came to me, though sometimes, because I was used to management by walking around, I would simply reach out. I sent a note when I first arrived to everybody in the department, said, anyone that has a good idea, you know, send it to me. Some young researchers at NIH came in, sent me an idea. They said, listen, we got this piece of research. We don't know what it means, but it would save thousands of lives. What was it? Sudden infant death syndrome. They had found out that if you put a kid on their back, it would reduce the amount of SIDS. And so I took it seriously, but this was someone that wouldn't normally have direct access to me. I just asked for ideas, like the Aspen Ideas thing. And so we ran a campaign called Back to Sleep and cut SIDS by 70%. Sometimes the secretary can't just use the system to get their priorities, but sometimes they have to reach out, and the culture of the organization has to be, both for the agency heads as well as for everybody else, that they can reach you with an idea. And sometimes those ideas save millions of lives around the world. And they're buried somewhere. They'll eventually get up. But sometimes you just have to ask.
Alex, can you say a little about balancing the various folks whose support you need to do the job?
And again, I think the private sector background led me to think this way very much as Secretary Shalala did. As the secretary, you're like the CEO. And so the more time you are spending on external stakeholder management, and as a secretary, that might be White House staff, congressional committees, media, various industry groups, as well as disease advocacy groups, patient groups, interest groups, et cetera. The more you spend there, the better. I think, honestly, you can't spend too much time there when you're at the CEO level or secretary level. So as I look back, if I think about regrets, it's wish I had had even more time to have focused there, because you want your deputy secretary, your chief of staff as much, and your agency heads as much as possible to be doing the operations, the day-to-day, and then call you for help when needed. But often you just, like Donna said, sometimes you just have to get sucked in and be involved. But you do want to delegate. I don't have any. I've never found the site for this, but someone once told me the story, so I love it, so it's true. That Eisenhower, when he was Supreme Allied Commander, he's sitting there and there's a reporter with him and he's just signing a stack of letters. And he says to the reporter, you know what leadership is? And the reporter says, no, Supreme Allied Commander, I do not. And Eisenhower says, it's signing these letters even though you know you could write them a damn sight better.
Yeah, sometimes I did edit. I have to admit, I'm an old editor. The other thing that I did, the White House is a complicated relationship, no matter how effective, whether you know the president or not, and I knew the president very well, and I could get to him directly. I spent a lot of time, and I've said this to cabinet officers, go an hour early to the cabinet meeting and just walk around and schmooze with the senior leadership. Dan Porterfield, the president of the Aspen Institute, worked with me that first year, and he had relationships already because he knew George Stephanopoulos. They had been Rhodes Scholars together. That made a big difference in the department, as did my chief of staff, the first chief of staff, Kevin Thurm. They had all been Rhodes Scholars together. Those relationships made a big difference, and a lot of the young people that we hired had actually worked on the campaign, and they had relationships. Those interpersonal relationships made a huge difference, not just because you could pick up the phone, but because there was a trust developed.
Well, you mentioned relationships, and Donna, you have this very unique experience. As you mentioned, Your hearings are before the inauguration, you're confirmed day one, and you're there for 8 years. And
Every minute of 8 years.
every minute of 8 years. And as you noted, you had a lot of stability in your team. That, I think it's fair to say, that's the last time we're going to see either of
Probably.
those. Immediate confirmation and 8 years of tenure, even if we have a president with 8 years. I wonder if you could reflect a little on what the benefits are of having that much time and what maybe as a country we're losing if we can never replicate that.
Well, I think it was a combination of being able to appoint my own team. And it wasn't that the president or the vice president didn't know. The Democratic Party is 10 deep on qualified people for each of those agencies. And we moved around a little bit, but not much. The young people, we moved around more because I wanted them to have different experiences. But it made a huge difference in policy making, in trust from the civil service, because you really have to co-opt the civil service. I used to say to them, you know, you've been waiting for us for 12 years. And we never had a meeting of just the political appointees. We integrated the top civil servants. So building those teams, having the stability, appointing people who were experts in their field. I didn't take a lot of general lawyers, with all due respect. He's not a general lawyer. But having people that were world experts in that subject matter made a difference to the civil service in terms of their respect for the knowledge of the people that were leading them, but more importantly, setting a tone that we were a team made a huge difference in terms of our ability to get policies through, particularly after the party switched and everything. We were bipartisan from the beginning. My view was I was nominated by the president, confirmed by the United States Senate, and since they all voted for me, I was responsible for all of them. So I didn't treat the Democratic senators any different from the Republican senators. And to this day, I have a lot of friends on the Republican side in both the Senate and the House because of the way the tone we set in terms of our respect for them and how we operated.
And you know, for me,
The White House was not enthusiastic about some of my approach, I want to point out.
well, and for me, I didn't have 8 years as secretary, thank God, but I had 6 years before at the department, and then the 3 as secretary. So just like Donna, I always had the approach, I said, I don't really care and I don't know who's political or who's career. It was not something I'd even ask, didn't know. I knew but I did know, had very deep relationships in the career civil service from my previous tenure. And so I had a pretty deep bench of people, relationships, trust, mutual, I think pretty deep mutual trust, and was able to work very directly with the career civil service to get things done. I think so much of it is treating people, just like in business, treating people with respect and empowering and creating a common sense of mission and vision that you understand the program they've devoted their life to and you want to make it better. It may not be the way they want to make it better, but you're committed to trying to make it better, why you're making the choices. And I always found tremendous loyalty and professionalism in the civil service by taking that approach.
You've both given some great examples of things that have happened during your time. You're both good storytellers. I wonder if you could pick a low moment and a high moment. It doesn't have to be the lowest, it doesn't have to be the highest, but this must be a job where some days are great and some days are really hard. What examples could you give me of a high and a low, and what made them high, what made them low? Maybe Alex, I'll start with you.
Let's start negative and then we'll go.
That's why I asked them both together, so that we can always end on the high note.
January 6th, low point. How could it not be? You know, as a lawyer, as a scholar of the Constitution, as someone who's devoted his life to our system of government, a terrible, terrible day, low point. High points. I'm going to give a couple, if you don't mind, real fast. When I got to sit in the State of the Union and the President of the United States announced the initiative to end the HIV epidemic within 10 years, which I had mentioned to him, and to get that launched, very high point. the Ebola outbreak that we had in the Eastern Democratic Republic of the Congo, which we were terrified of. This is one of the most dangerous places on earth, 174 different warring groups, no civil society, and this was blowing up out of control. And to play a role working with Tony and Cliff Lane and others at NIH to get actual vaccines developed in a war zone, to get monoclonal antibodies developed in a war zone, and then to personally go over with Tedros and the presidents of the DRC, Uganda, and Rwanda, and basically get that organization functioning there, and we solved it, and one of the worst potential public health outbreaks in history went away, and it wasn't noticed because, of course, it was declared at the end of that outbreak in July of 2020, and there were other things on people's minds. Huge high point. Then, of course, there was the morning when Steve Hahn called me to tell me the clinical trial results on the vaccine. So, some very high moments and some very low.
Well, obviously the failure of our health plan in the first year, it was a mess, frankly, and that was a low point. But Oklahoma City just was devastating. I lost a lot of employees, including the child of one of the IG employees who was in that child care center. It was heartbreaking. It was heartbreaking. Ron Brown's plane going down, he was a very good friend, a great political advisor to Bill Clinton. Those were, terrible experiences. I think the failure of my failure to convince the president to allow us to do needle exchange was the policy low point for me. He was wrong, and I had every health leader in the department sign a letter to him explaining that the research was very clear. We could reduce the number of infections, HIV infections, with needle exchange. It was very important. But he made a political decision. Years later, he admitted that was a mistake. But the high point was that we didn't back down on the research. That we got a call from the White House that basically said, what Shalala should say is we need more research. And I said, absolutely not. I'm going to get up and say, with Tony Fauci and the Surgeon General, and I think it was David Satcher at the time, and everybody else, and simply say, the research is clear. The president has made a decision that he doesn't want CDC money to be used for this purpose, but states and cities ought to go ahead because we're going to save lives, and we're going to do everything we can in the department to be supportive. I went to the community foundations. NIH actually used some of its money to fund some demonstrations around the country. We didn't back down on the science, even though the president, in my judgment, made the wrong decision. And, there were lots of policy highlights, doubling the NIH budget. For me as an academic, and I said to Bill Clinton, this is your legacy. You double the NIH budget and you'll usher the golden age of biomedical research. The basis of that became what Alex used and the private sector used to build the vaccine. We generated a new generation of biomedical scientists, and it changed our world as we can see it. But more than that, we built a bipartisan coalition for NIH. And that made a world of difference. The Children's Health Insurance Plan. When you lose a big one, as we did on healthcare, we pivoted, built a bipartisan coalition, Orrin Hatch and Ted Kennedy, and passed the Children's Health Insurance Program for working class kids. 7 million now are in that program. I can go through the Human Genome Project. I can go through, because I was there for so long, I can go through a long list. And I guess for me personally, getting all the kids in the country immunized by the time they were 3. And I tell the story, I went to the public health people in a meeting like this, and they said, you can't do it. The parents don't know even the names of the diseases, the public health isn't organized for it, the pediatricians don't have the shots. We went and we got legislation, we wrote down the cost of those shots. But in that room was all the naysayers. And I remember exactly what I did. I reached into my purse and I pulled out a postcard that my golden retriever, Bucky, had just gotten from his vet. And it said, "Dear Bucky, time for your next shot." And I waved it at all these brilliant public health people, and I said, "Look, if we can get all the dogs and cats and cows in this country immunized on time, and they have a tracking system and we have no insurance for it, we can get the kids immunized." And frankly, we built that. I was saying to someone the other day, the Bushes, Governor Bush, ran the Shots for Tots in Texas. All of the first ladies or first men in the states ran the campaigns. We said, relabel them, get these kids their shots by the time they're 3. We gave the vaccines to the pediatricians who had never really done this, and we built a tracking system and got 90% of the kids vaccinated on time. American kids were healthier and wealthier by the time we left the administration, but it's because we were persistent. And Bill Clinton said that my dog should get an award. The CDC director was not as enthusiastic about awarding the Bucky. I came from Wisconsin, so it was Bucky Badger. My dog was named after Bucky Badger. My current dog is named after Tony Fauci, I want you to know.
So, Donna, the story you tell about needle exchange makes me want to ask a slightly thorny question. I think if you asked the American public who are saturated with what they hear every day, they would say it's all politics. All of these differences are politics. If you work inside, you see substantive, ideological, evidence-based differences. It's policy, it's not just politics. But I think we have a pretty cynical audience. I don't mean here. We have a cynical country that sort of lost sight of the real underlying differences and disagreements that are value-based, not just partisan. So you both obviously worked in incredibly partisan context. How much did you feel that your day-to-day work was driven by genuine policy differences, and how much was it driven by partisan, someone's got to score a point or avoid embarrassing their party?
Let me give you a quick answer. First of all, I see the interface between politics and policy. So in doing policy, you have to be aware of the politics. But in particular, what the stakeholders? I did Hipaa. We negotiated with every stakeholder to get the privacy rules in place. At that time, it was just clinical data. But, and so it was different cultures, different ideologies to put that together. So you try to find a balance between the two, but you keep your eye on the ball. What you're interested in is the outcomes, not how you have to get there, but the outcomes in the system. So it's the interface between the two. You'll lose some and you win some. My philosophy has always been, when you hit a brick wall, just turn and go in another direction, because there's lots to be done. And you just keep going, but you keep your eye on the ball, and that is improving the lives of Americans and people around the world, no matter what direction you choose to go in.
Yeah, no, So I think of myself as not terribly political, more of a technocrat, certainly in that kind of role. Obviously, Don and I both have political views, very strong political views.
We're both Lebanese, too, I want you to know.
We're somewhere related, we know. And, the way we get along, we've been very good friends for a long time. In fact, I used to call Donna when she was in Congress. I would secretly call her for mentoring and advice, because there's not a lot of people you can talk to. We have probably 10% of issues that we just don't talk about, because there's literally no way I'll convince her, she'll convince me, and that's fine. But on 90%, 80, 90%, we probably agree, or at different, variations.
Different approaches to get there.
Different approaches, exactly, right. Shared goal. What I tried to do both at Lilly and at HHS is, my approach to problems is, don't start with the solution, really deeply diagnose the problem at a micro level, look at the economic forces, why is what's happening, and try to solve with the Occam's razor of solution, the minimum interventionist approach to solve the precise problem and issue. That ain't good politics, trust me. Like drug pricing. The drug pricing agenda I laid out is the agenda that will get drug prices down at a very micro-targeted level from somebody who lived in the middle of that system, but it doesn't have the banner headlines of just do X and the easy thing for the campaign stump. And so I tried to always be focused that. Now, others might take a different approach as an economic or business matter thinking about that, but I tried to teach people, think about it, why is this not working? Based on a law professor of mine, I took zoning in law school, of all things, just because this professor is so great. And he used to say, when you're headed into Manhattan and you're on Metro North and you see just burnt out buildings and land that's not being put to its highest and best use, ask yourself a question. Where is the government involved here? So when you see something irrational happening, is there something going on where the government has messed up natural market forces that should be operating for things to function efficiently? And so with any aspect of our public policy, I try to say, why do prices keep going up for drugs? Why do prices go up for hospitals? Why is there not competition? And then take it down and break it down to a microeconomic level. Think about what are the regulatory incentives and barriers and work on fixing those. And that's very, maybe ideological, but it's very technocratic, I think, not political.
Well, it's analytical.
Yeah.
It's first-class policy analysis, as Alan will tell you. It's, when we did Hipaa, we started with principles. We had been talking about this earlier in the week. We started with the principle that healthcare information should be used for healthcare purposes. Now, in general, in government, they don't start with principles. They start immediately jumping into the regulations. But for those of us that are analytical about these things, and I'm a political scientist, we start with principles and then build out from there in terms of where we want to go.
I'm going to ask one more question and then open it up to you all, so be prepared. But as you're thinking of your question, I hope you'll acknowledge the tone of this conversation. We're not here for political points. We're here to understand what it's like to have the responsibility that these two very talented people have. My last question, unless you all have no more, is you actually, Donna, at the very beginning noted that there was a letter from your predecessor waiting for you. Institutional memory and knowledge is at a premium. What in that letter, if you remember it, was most useful? What do you wish had been in there that wasn't? And did you write a letter to your successor?
No, I did write a letter to my successor warning about bioterrorism and the possibility of an outbreak. At that time, we were thinking about upper respiratory diseases and the possibility of a flu pandemic and the need to put together a system to attract that. The letter that I got actually focused on the health of children, which was close to our heart. Hillary and I had been involved in the Children's Defense Fund for many years, and that was an easy agenda to follow up on.
So given as you remember, I'm the second secretary in the Trump administration. Given the circumstances of how that all happened, I did not get a letter. I had nothing to do with the departure, but there was, my predecessor was not there to.
It wasn't sent by airmail.
Right.
Sorry, inside joke.
But I hope it comes through. While I have very distinct political ideological views, I also have great respect for people on the other side of the aisle and value my relationships there. When I became general counsel of HHS, the first call I made was to Harriet Rabb, who was Donna's general counsel. Before I became secretary, when I was first nominated, I called Kathleen Sebelius, I called Sylvia Burwell. I, of course, already had deep relationships with Tommy Thompson and Mike Leavitt. And I continued in office talking especially to Donna, to Sylvia Burwell, and then Mike Leavitt, who a lot of just how do you deal with relationships? You can imagine the Trump administration, you need a lot of coaching on how to deal with people and relationships. And just having somebody you could just bounce off and get counsel and advice from is very important. So no letter for me. I did write a letter to Secretary Becerra. I wish it had great pearls of wisdom. It was probably, I don't remember every item of it, but it was generally handing him this department that I love and care for so much, that is the centerpiece of my life, and entrusting it now to him and saying, take care of it, and wishing him the best in doing so.
Okay, this is a unique opportunity for you in the room. I hope someone will take advantage of it. So there are microphones running around. It's hard for me to see with the lights, so help me out. And please say your name and make it a question.
Sure, Monica Van Buskirk. And I know many of the conversations at this conference have been around the cost of healthcare. And as you guys mentioned, you have quite a large budget when you had your tenure. Often that is driven by the fee-for-service incentives that we have. Under both of your tenure, there has been some progress made on value-based payments. When do you think our country is going to start to turn the corner on that and shift from paying for volume instead to paying for value? And what are the ingredients we need to do that?
Yeah. Why don't let Alex answer?
You have a major initiative.
So for me, this was the first major speech I gave in February, when I came in February. This was a journey that Donna had been on, Mike Levitt had really pushed this, Bill Burwell had really advanced things. And this was the burning the boats moment, I said. I was like, listen, we are not going backwards to fee-for-service. It's time to really just move forward into that. And so it was, I'll try to remember every element of it, but it was radical transparency of prices, which I still think those rules, which are in place still, but haven't been fully implemented yet, those are going to blow the system up, because once the pricing, the list, the net, and the negotiated pricing and the cash pricing is fully out there and available, the system can't stand the way it is. So that will be a major impact. The other was changing the rules around collaborative aggregated care. All of the artificial barriers to providers who weren't co-owned working together around the patient. So that was another. The third was interoperable health IT. We put out the health IT records and information blocking rules to finally say, this is it. We've electrified, but now we're sharing, and the patient owns that information. It goes with them. And the fourth key enabler was changing payment policies. For me, the only way we get there, we've had these nice experiments. We did first bundles, and then we did ACOs, whatever one calls it, but getting alignment of physicians with the patient around delivery of care. We called it direct contracting. I think the current administration is calling it ACO REACH. But saying, here's a capitated amount of money, you, the provider, take the risk, working with the patient, keep them out of the hospital, keep them out of the nursing home, reduce cost, and we don't care basically how you spend that money. So fund all the social determinants of health, put in a ramp, put in air conditioning, have food delivered. If it keeps that patient from having to go to the hospital for visits, then fund it. And the bet gets made at the local level by the physician integrated with the patient, instead of us in Security Boulevard deciding whether you can pay for this, that, or the other, because we're afraid of providers turning the crank on the fee-for-service system. When we get to that, I think when we get full implementation on transparency, and when we see us actually paying provider-level capitation, then I think we've really crossed the Rubicon, but I hope we'll see that continue.
I think we'd get into too detailed of a discussion. I'm not as sure about the effectiveness of transparency as he is. So why don't we take the next question?
That's good. It's a good.
Otherwise, we'll have a very detailed policy discussion.
Okay, we'll go here and then here, and we'll see how we're doing on time.
It's not that I disagree, by the way, with much of what Alex said.
Hi, I'm Peter Rigby. I'm certain someone can ask this question more articulately than me, but if the Supreme Court rules in favor of the plaintiff in West Virginia v. EPA, which I guess might affect how agencies, particularly the sixth largest economic entity in the world, makes policy and promulgates regulations, how's it going to change the world at HHS?
So I think you actually asked that very well, but I will broaden it out. The role of rulemaking, you mentioned your course on zoning. I took administrative law from Justice Breyer, so I'm big into the APA. Again, that's sort of a black box for most people. You mentioned negotiating Hipaa. Talk about, if you don't mind, I'll just sort of expand out the importance of that role and the challenges associated with it, particularly if the parameters for rulemaking change. How's that policy question?
We took on the tobacco industry by setting out a set of rules and regulations, assuming that FDA had jurisdiction. Now, Janet Reno said to me, we're never going to win this case. It's too fuzzy, it's going to go all the way to the Supreme Court. And I said, I don't care, because we're going to turn these guys into the bad guys. They're targeting children, and that's unacceptable. And we're going to get the states to start putting some rules in place about how they can sell cigarettes, and we're going to reduce the number of kids that start smoking, despite what the Supreme Court's going to do on whether we actually have jurisdiction. So it was a whole campaign. If you want to see an example of activist government, that was an example where we knew that eventually the Supreme Court might rule against us in terms of our jurisdiction. And they did. They ruled against us. And it took years before Congress gave FDA the authority. But meanwhile, we actually changed the world. We reduced the number of kids that started smoking. There were attorney generals that came in and got huge settlements. And the states in particular took a very strong role to reduce the number of kids that had access to cigarettes. And FDA had some rules that they could put in place, and CDC was a huge player. In fact, if you'll remember the 1999 Women's World Cup, I remember Julie Foudy and Carla Overbeck, the co-captains of that famous women's soccer team, coming to see me, and I took them down to CDC. But what they wanted was they were about to go around the country and gin up interest, and they wanted a public health campaign to go with it. CDC designed a campaign called Smoke Your Opponent, Not Cigarettes. And, you know, I didn't know how important women's soccer was in this country until CDC had the press conference, and there were a bunch of squealing little girls at the press conference to see mostly Mia Hamm. But we did some things using the rulemaking process where we knew that there was a chance that we'd be thrown out in the courts, but we were trying to change and protect children in the country. So that's one example. The other example, of course, is the Hipaa example. That's the non-activist government. That's a process in which we negotiated with all the stakeholders and were extremely careful in the process.
This seems somewhat hypocritical. When in power, love the delegation and the immense power that you have under the regulatory authority. When out of power, probably like if the court goes a little more restrictive on that. I believe in notice and comment rulemaking, the public processes around that, and I don't, if the court pulls back on the ability of agencies to fill the gaps of legislation, which is really what is at issue, it could very much freeze the ability of government to operate because Congress legislates so infrequently and legislates with such lack of precision. I mean, literally, in the Affordable Care Act, there are conflicting provisions. Mm-hmm. I mean, in one place it says do X, and the other place it says do not X. And so how do you resolve those kinds of things? It could pretty radically restrict where secretaries are able to go and put the ball in Congress's court, which is probably where the framers wanted it, but given how Congress functions, it could very much enshrine the status quo of things.
So we'll do a quick last question with some quick last answers and wrap up the session right up here in the front.
Hi, my name's Jishan. I work in psychedelic medicine. We talked a lot about physical health. I'm curious, what the next secretary needs to do on mental health for this country.
On mental health?
That was a quick question without a quick answer, but I'll let you either one of you take it.
So first off, I was the first Republican secretary to declare that addiction is a disease, not a moral failing, and supported medication-assisted therapy as the gold standard of treatment, and we radically expanded MAT. I believe the next frontier of health reform is mental health reform.
I agree.
We are, I think, the last nation on earth that continues to pay for mental health care through grants and cash. And I think COVID is really going to lay bare the inadequacy of number of providers, access to care, and funding for care for mental health. I think that's the next frontier.
Well, you did give us a quick answer, and one that needs some expansion, but not here today. Well, I know it's become a bit hackneyed, but I am going to say thank you for your service. This is a service position. It's not one to be taken lightly, and it's wonderful to get the insights, not just the incredible accomplishments that you've both described, but the insights of what it means to be in that seat, a seat that probably none of the rest of us in the room will ever sit in. And so it's a real treasure to hear your experience. Thank you for participating as the audience, and for those who are watching us live or later, it's great to have you as our guests here at the Aspen Ideas Health. We're off to a great start. Thank you, secretaries. Please join me in a round of applause as we close our session.
Okay.